Welcome back to the Derm Couch, everybody. I want to address one of the more common issues or complaints that people come aesthetically to P. Frank MD, particularly those patients that have been doing injectables for well over a decade, where they feel they're resistant or no longer, injectables don't work for them. Their fillers are going quickly, their Botox or Xeomin is not lasting as long or not getting rid of wrinkles the same way. And what they don't realize is that although sometimes we do gain resistance and sometimes we have to change products or try things a little different, it does occur. But most commonly, patients are just getting older. And, we can't eat the same way we did 10 years ago. You don't exercise the same way you did 10 years ago. Our body, we don't always adapt 100% to time, and we have to change the way we do things. Well, with injectables, we have to do the same thing. Our baseline muscle tone of our face is weakening regardless of injecting neuromodulators. Our brows get heavy. Instead of wrinkles being caused by the orbicularis oculi muscle, we get wrinkles because of the accordion effect of our smile. And we can't paralyze the whole face. We have to keep some baseline motion. So people have to change their expectations. And there are some techniques we use, including changing the product, to kind of help patients along. And sometimes as we get older, doing less more often gives a better effect, because we don't want to change the morphology of the facial animation to something that's unnatural, or something that will weaken someone's smile, or something that will make the brows heavier. We have to be more conservative around the eyes sometimes. We have to be more conservative around the forehead sometimes. Sometimes an option for patients is getting your eyes done or getting a brow lift. And then patients still can go back to their neuromodulators and get the effect that they're looking for. So it's not so much that people are getting resistant, even though that occurs, it is a rarity. But we just have to sometimes, every 5 or 10 years or so, reevaluate the effect. I'll often tell a patient who's complaining of this, let me do the injectables as I feel are necessary, and then come back for a follow-up at 2 weeks. Sometimes a simple extra dose, kind of an icing on the cake dose, gives them the effect that I want. If you challenge the body with too much of any drug at the same time, you may have an adverse effect. I always say 2 glasses of wine at the same time is a different effect than an hour apart. And we have to look at dosing people as they get older in various ways to adapt to their needs as we get older. And sometimes surgery is an option, because injectables don't work for us the same way. It's the same thing with fillers, particularly hyaluronic acid fillers. Patients would say, I eat through my fillers so much. And yes, people still use fillers, and they are not the forever chemicals that some people say. When used in the right way, in the right amount, in the right area, with the appropriate weight or viscosity of the product, they are metabolized. When we overfill or we use products that are too viscous and too heavy and retain too much water, they can compress the lymphatic and vascular drainage and, of course, affect the metabolism. But I often use light to medium weight fillers, particularly around the mouth. Now, someone who exercises a lot, they're going to go through their fillers and their Botox a little quicker. Areas around the mouth are very mobile. They're going to eat them up quicker than, let's say, putting it in the temple, where we would probably use a thicker substance. The key point here is that as we get older, our reaction to things change. And the art of doing aesthetic medicine, particularly with injectables, is kind of growing with the patient, learning about how they deal with things. There are certain generalities as we get older that everyone deals with, but everyone kind of has to get individualized care. And this is a common thing, because now, injectables have been around for decades now, as is the experience of the patient. So, talk to your provider. There are techniques to get things to work for you. And if they don't work, well, then these are the times to consider surgical intervention. And by the way, even after you have surgery, most people want to reestablish a relationship with neuromodulators, reestablish a relationship with fillers, whether it's in the temple or around the mouth or any of their other needs. So that is the Derm Couch for today. I'll speak to you soon.